Welcome to Special Education with Hamid Naqvi. Let us continue practicing MCQs relating to visual impaired field. This is the fourth video of its type. Here we start. First MCQ is what is the cause of retinitis pigmentosa? Viral infection, genetic mutation, autoimmune disorder, or nutritional deficiency? The answer is genetic mutation. Explanation we can give that retinitis pigmentosa is a group of inherited disorders that affect the retina, leading to progressive vision loss. Next MCQ is what is the primary symptom of glaucoma? Central vision loss, peripheral vision loss, complete blindness without symptoms, double vision. The answer is peripheral vision loss. Glaucoma often leads to peripheral vision loss due to increased intraocular pressure. Next is which part of eye is affected by macular degeneration? Cornea, retina, lens, optic nerve. The answer is retina. Macular degeneration affects the macula, the central part of the retina responsible for sharp vision. What is the main cause of diabetic retinopathy? Excessive light pressure, excessive light exposure, uncontrolled blood sugar levels, genetic mutation, or vitamin A deficiency? Answer is uncontrolled blood sugar levels. High blood sugar damages the blood vessels in the retina, leading to a diabetic retinopathy. Next is which of the following is a leading global cause of blindness? Cataracts, diabetes, hypertension, or glaucoma? The answer is cataracts. Cataracts are the leading cause of blindness worldwide, primarily due to the clouding of the lens in the eye. Next is which of the following is a common strategy in orientation training? Mental mapping of environments, strength training exercise, focusing on auditory distractions, ignoring physical landmarks. Answer is mental mapping of environments. Orientation training emphasizes creating mental maps of spaces using auditory, tactile, and spatial cues. Next MCQ is what is the primary focus of a pre-cane skills training? Use a cane to detect obstacles, developing sensory awareness and protective technique, training with GPS devices, or practicing with tactile maps. The answer is developing sensory awareness and protective techniques. Pre-cane training develops the individual's ability to use other senses and body positions for safety and orientation. Next, what is the role of auditory localization in mobility training? Identifying colors, detecting light intensity, locating objects of landmark using sound, or measuring distance. The answer is locating objects or landmarks using sound. Auditory localization helps visually impaired individuals identify the direction and distance of sound sources for navigation. Next MCQ is which technique involves teaching a visually impaired individual to recognize consistent landmarks? Auditory feedback training, landmark-based orientation, sensory substitution, or coactive guiding. The answer is landmark-based orientation because it uses consistent environmental features to assist with navigation and direction finding. Next is what is the first step in guide dog training for visually impaired individuals? Learning leash commands, bonding with the guide dog, practicing indoor navigation, and teaching the dog advanced outdoor routes. Answer is bonding with the guide dog. A strong bond between the guide dog and its handler is essential before advanced training begins. Next is which of the following is taught during route familiarization? How to use GPS devices, navigating specific routes repeatedly to learn them, interpreting braille signs, or operating electronic magnifiers. Answer is navigating specific routes repeatedly to learn them. Route familiarization involves repeated practice of specific routes in order to build confidence and memory for independent travel. Next MCQ is who invented Braille? Helen Keller, Louis Braille, Samuel Morse, or Anne Sullivan? The answer is Louis Braille. Louis Braille, a French educator, invented the tactile reading and writing system for visually impaired individuals in 1824. How many raised dots are used in Braille? 4, 6, 8, 10. Answer 6. The standard Braille cell consists of 6 raised dots arranged in a rectangular matrix of 2 columns and 3 rows. What is a grade 1 Braille? A basic form of Braille representing each letter individually, a contracted form of Braille, a Braille for mathematics, or Braille for music notations. The answer is a basic form of Braille representing each letter individually. Grade 1 Braille is uncontracted Braille, while each character responds to a single letter or punctuation mark. Which condition involves inflammation of cornea? Glaucoma, keratitis, retinitis, or uveitis? The answer is keratitis. Keratitis is the inflammation of the cornea, often caused by infections or injury. Which vitamin deficiency causes night blindness? Vitamin A, vitamin B12, vitamin C, or vitamin D? Answer is vitamin A. Vitamin A is essential for the production of rhodopsin, necessary for low light vision. Next is what is the cause of river blindness? Viral infection, parasite, bacterial infection, or fungal infection? Answer is parasite, and river blindness is caused by a parasitic worm transmitted through black fly bites. What is the common cause of corneal blindness? Eye injury, infections like herpes simple virus, vitamin A deficiency, all of the above. The answer is all of the above. Corneal blindness can result from trauma, infections, or nutritional deficiencies. Which condition is associated with increased intraocular pressure? Cataract, glaucoma, retinal detachment, or uveitis? Answer is glaucoma. Elevated intraocular pressure in glaucoma damages the optic nerve leading to vision loss. Which daily skill is most commonly taught in rehabilitation programs for the visually impaired? Playing sports, cooking safety, singing, dancing. Answer is cooking safety. Cooking safety is a critical life skill taught to ensure independence in daily living activities. What is tactile graphics? Graphics that emit sound, text-based learning material, raised line diagrams for touch, colored visuals. Answer is raised line diagram for touch. Tactile graphics use raised lines and textures to help visually impaired individuals interpret diagrams and maps. What is the primary focus of an individualized education program, in short IEP, for visually impaired students? Standardized teaching methods, customized goals and accommodation, peer-based assessment, or group learning strategies? The answer is customized goals and accommodation. IEPs are tailored to address the unique learning needs and strengths of students with disabilities. Next is which teaching method is most effective for students with low vision? Reliance on auditory cues, use of large print and high contrast materials, visuals only teaching aids, independent reading tasks. Answer is use of large print and high contrast material. High contrast and large print materials enhance accessibility for students with low vision. Which barrier commonly affects the visually impaired in accessing education? Availability of teachers, lack of accessible material, excessive funding, or overcrowded classrooms? Answer is lack of accessible material. The scarcity of materials in Braille or other accessible formats is a significant barrier to education for visually impaired. Next is what is the impact of social stigma on visually impaired individuals? Improved access to services, increased confidence, reduced opportunities and inclusion, or enhanced social interactions? The answer is reduced opportunities and inclusions. Social stigma can limit opportunities for education, employment, and community involvement. Next is what does universal design aims to achieve? Specialized tools for specific disabilities, designing environment accessible to all, exclusivity in infrastructure, separation of individuals with disabilities. The answer is designing environment accessible to all, because universal design promotes inclusive access, benefiting everyone, including those with disabilities. What is the most effective way to guide a visually impaired person? Hold their arm tightly, verbally offer guidance and let them take your arm. Push them gently in the right direction. Avoid offering help unless asked. Verbally offer guidance and let them take your arm. Allowing the person to take your arm gives them control and ensures safety and comfort. Which of the following improves communication with visually impaired individuals? Speaking slowly and loudly, using clear descriptive language, avoiding direct conversation, using hand gestures. Answer is using clear descriptive language. The reason is descriptive language helps convey visual information in an understandable manner. Which vitamin F deficiency is a common cause of preventable blindness in children? Vitamin A, vitamin B, vitamin C, vitamin D. Vitamin A. Vitamin A deficiency can lead to uh, exophthalmia and blindness in children. What is primary prevention strategy for congenital blindness? Genetic counseling, eye surgery, visual therapy, or screen magnifying? Genetic counseling, because genetic counseling helps identify and mitigate hereditary risk of congenital blindness. Which of these conditions can diabetic retinopathy cause? Tunnel vision, complete blindness, peripheral vision enhancement, color blindness, complete blindness. Diabetic retinopathy damages retinal blood vessels, potentially leading to total vision loss. Which law in United States ensures free and appropriate education for children with diabetes? IDEA, ADA, Section 504, or Family Education Act? The answer is IDEA, which is short of Individual with Disability Education Act. IDEA mandates individualized education and services for children with disabilities, including visual impairment. What does the Marrakesh Treaty focus on? Accessible digital education, access to published works for visual impaired, healthcare for visual impaired individuals, transportation facilities for people with disability. The answer is access to published work for the visual impaired. This treaty facilitates the creation and sharing of accessible formats of copyright works. How can teachers support the emotional needs of visually impaired students? By lowering expectation, by fostering peer interactions and inclusivity, by isolating them for one-on-one instruction, by giving professional treatment. The answer is by fostering peer interactions and inclusivity. Promoting inclusion and peer support helps visually impaired students feel valued and confident. Which psychological challenge is commonly faced by visually impaired individuals? Depression due to isolation, hyperactivity, enhanced memory issues, decreased communication skills. Answer is depression due to isolation. Social isolation can lead to feelings of loneliness and depression among visually impaired individuals. Which part of the eye is responsible for sharp central vision? Cornea, macula, sclera, choroid. Answer is macula. The macula located in the center of the retina is essential for detailed tasks like reading and recognizing faces. What is the primary role of optic nerve? To regulate eye movement, to transport visual information to brain, to produce aqueous humor, to control the pupil size. Answer is to transport visual information to the brain. The optic nerve carries signals from the retina to the brain for visual processing. Which of the eye provides blood supply to the retina? Cornea, choroid, sclera, or vitreous body? Answer is choroid. The choroid is a vascular layer that nourishes the retina and other parts of the eye. Or what is the function of aqueous humor? To maintain eye shape and pressure, to focus light onto the retina, to protect the retina from UV light, or to transmit visual signals to the brain. Answer is to maintain eye shape and pressure. The aqueous humor is a clear fluid that helps maintain intraocular pressures and nourishes the cornea and iris and lens. Which eye condition involves increased pressure that damages the optic nerve? Cataract, glaucoma, retinal detachment, or macular degeneration? The answer is glaucoma. Glaucoma results from the high intraocular pressure leading to optic nerve damage and potential blindness. What is the name of the transparent dome-shaped outer layer of the eye? Iris, lens, cornea, retina. Cornea. The cornea acts as the eye's primary lens, bending light to help focus it onto the retina. What is the primary role of rods in the retina? detecting color, night and peripheral vision, and maintaining eye pressure, producing tears. Night and peripheral vision is the answer. Rods are highly sensitive to low light and essential for night and peripheral vision. What is the conjunctiva? A transparent layer over the retina, a thin membrane covering the sclera and inner eyelids, the muscle controlling lens movement, the part of the eye that produces tears. Answer is a thin membrane covering the sclera and inner eyelids. The conjunctive protects and lubricates the eye by producing mucus and tears. What is the function of the suspensory ligament in the eye? They anchor the retina in place. They adjust the position of the iris. They hold the lens and adjust its shape. They produce aqueous humor. Answer is they hold the lens and adjust the shape. Suspensory ligaments connect the lens to the ciliary body and help adjust its shape for focusing. Best of luck and see you in the